So hey friends, if I tell you the size of a breast tumor, the lymph node involvement and the metastasis, can you tell me the stage of a cancer in 10 seconds? If not, then continue the video. So hello everyone, today we are going to understand TNM staging of the cancer in a simple and a relevant way. So why TNM staging is very important? TNM staging is extremely important for diagnosis and treatment planning of a breast cancer. The TNM staging is given by AJCC, that refers to the American Committee on the Cancer. So further, what the TNM staging means? The TNM staging, we divide it into the T, N and M staging. So starting with the first T staging, which refers to the tumor size, N staging, which refers to the lymph nodes involvement, and M staging, which refers to the metastasis. So starting with the T, that is the T stage or the tumor staging, which refers to the primary tumor size. So it is staged as initially, that is Tx, which refers when the primary tumor cannot be assessed. Then it is T0, when there is no evidence of a primary tumor. The third one is the TIS, that refers to the carcinoma in situ. Example are the DCIS or the ductal carcinoma in situ or the Paget's disease of the nipple, that are pre-invasives. The T1 stage is given when the tumor is 2 cm or less than 2 cm across. The T2 staging is given when the tumor is more than 2 cm but not more than 5 cm. That is 2 cm to 5 cm. More than 2 but less than 5. T3 staging is given when the tumor is larger than the 5 centimeter across the breast. T4 is given when the tumor of any size growing in the chest wall or the skin involvement is there. Further, T4 is divided into two parts, that is T4A and T4B. T4A is given when when there is a involvement of a chest wall. Chest wall, as we know, it is comprised of the serratus anterior, the ribs, and the intercostal muscles. It is important to note that pectoralis muscle is not considered to be the involvement in the chest wall. And T4B, T4B is stated when there is involvement of the skin, that is if there is ulceration, direct infiltration, and PDO or the Pios de orange appearance is there. The another part is T4C. It is stated when there is both chest wall involvement and skin involvement. And T4D, the last, is staged when there is an inflammatory cancer present. Further subcategories of the T1s are there. Some important are the T1MI, which refers when the tumor is less than 1 mm in size and there is micro invasions, that is less than zero point 0.1 centimeter. T1 is further divided into T1A, T1B and T1C. T1A is stated when the tumor is more than 1 mm but less than 5 mm in size. T1B is stated when the tumor is more than 5 mm but less than 10 mm. And T1C is when the tumor is more than 10 mm but less than 20 mm. The next part of the staging is the N stage, that refers to the lymph node involvement stage. So starting first is the N0 staging, when there is no cancer in the nearby lymph node or there is no regional nodal metastasis. The second is the N1 staging. It is when the palpable mobile mass in the axillary nodes on the similar side or the ipsilateral side is there, then it is staged as a N1. Or when one, two, or three axillary lymph nodes under the same arm are involved, then it is also staged as a N1. The next is N2 staging. The N2 is further subdivided into N2A and N2B. N2A is given when the fixed ipsilateral axillary nodes are involved. That is, the fixed axillary nodes of the same side of the arm are involved. The N2B is given when there is a presence of internal mammary node in the absence of the axillary lymph node. The next staging is the N3. N3 is further divided into three: N3A, N3B, and N3, N3C. N3A is given when the same side infraclavicular lymph node are involved. That is the ipsilateral infraclavicular lymph nodes. And N3B is given when the axillary lymph node along with the internal mammary lymph nodes are involved. The last is the N3C, is given when there is ipsilateral supraclavicular lymph node involvement. That is, the lymph node of the same side above the clavicle are involved. So the next staging is M staging, which refers to the distance metastasis. So the most common site for the distant metastasis in some cancers are lungs, bones, brain, and liver. So metastasis staging is given into two: M0 when there is no distant metastasis or there is no metastasis to the any organ, and M1 when there is a distant metastasis present. Anatomical stage groups. So these are divided into four types. Total four types: stage 0 to stage 1A, stage 2A, stage 3, and stage 4. So firstly, the stage 0 is given when the tumor is TIS or the tumor in situ, and there is no metastasis or the nodal involvement. Stage 1A is given when the tumor is there, that is T1, but there is no nodal involvement or the metastasis. So stage 2A is having two situation when there is tumor, there is a nodal involvement but there is no metastasis, and the second situation when there is a tumor T2, but there is no tumor of stage T2 but no nodal involvement or no metastasis. Stage 3 is given when there is any T stage nodal involvement of the N3 staging, and no metastasis involvement. Stage 4 is given when the tumor is of any T staging, any N staging, but metastasis involving of the M1 stage.